F. Kennedy Jr. sparks rifts at CDC with controversial vaccine. Robert F. Kennedy Jr.'s tenure as health secretary has led to an unprecedented divide between acting CDC officials and the presidential administration. His anti-vaccine stance culminated in the dismissal of CDC Director Susan Minares on August 26, following her refusal to retract approvals for several COVID-19 vaccines. The U.S. Department of Health and Human Services confirmed Minares' departure via tweet, stating, "Susan Minares is no longer director of the Centers for Disease Control and Prevention. We thank her for her dedicated service to the American people." Shortly after, a group of senior CDC officials submitted their resignations, expressing concerns over RFK Jr.'s detrimental influence on the healthcare system. In her resignation, Chief Medical Officer Dr. Deborah Oury emphasized the importance of scientific integrity at the CDC, stating, "For the good of the nation and the world, the science at CDC should never be censored or subject to political pauses or interpretations. Vaccines save lives. This is an indisputable, well-established, scientific fact." She warned that the rise of misinformation had dire consequences. Dr. Dimitri Daskalakis, director of the National Center for Immunization and Respiratory Diseases, voiced his resignation through X, criticizing HHS leadership for a lack of communication. He remarked, "The intentional eroding of trust in low-risk vaccines will bring us to a pre-vaccine era where only the strong will survive and many, if not all, will suffer." Daskalakis stated he could not continue in an environment that misuses CDC's authority to promote harmful policies. Dr. Daniel Jernigan, director of the National Center for Emerging and Zoonotic Infectious Diseases, also submitted his resignation, asserting, "I believe strongly in the mission of public health. However, given the current context in the department, I feel it is best for me to offer my resignation." The fallout from RFK Jr.'s leadership illustrates a significant upheaval within the CDC as it grapples with the implications of rising vaccine skepticism.